Jim!
What do you find students are most surprised by when you teach about global healthcare?
Generally speaking, what I find most students are usually shocked when, contrary to the popular opinion that's kind of spread through the media and stuff like that, is that how bad U.S. healthcare ranks to the rest of the world.
What do you think about healthcare in the United States?
I think it's pretty good.
So what do you guys think about the healthcare in the U.S.?
I honestly don't know anything about the U.S. healthcare right now. I can say the same, I don't know much.
I've just heard that it needs some reform. It's been in the news.
Among developed countries, we're the least productive and effective healthcare system, but the most expensive. We rank 65th in the world.
What do you think are some of the biggest issues with healthcare today?
Well, in America, it's the cost.
Just the accessibility and the price.
In developing country and developed country, so chronic disease like cancer occupies higher mortality rates in recent years. Epidemic disease still is major component of mortality rate. About 378 million people careers worldwide. To deal with the epidemic disease, healthcare system is essential to record the medical information of patients to prevent infection of disease. Take HPV as an example. One main factor of transmission is the inappropriate use of medical instruments and indirect infection which is caused by incompetent medical system. HPV is spread by body fluid and mother-children transmission. The pre-hospital trauma system isn't established advanced in a developing country, whereas developed country establish an efficient system to help record the information of patients and prevent of epidemic disease. For developing country, especially for African country, while doctors are operating on patients, doctors don't know medical history of patients. Medical instruments won't be disposed scientifically. Thus, HPV career rate is over 8% in developing countries such as Central Asia republics, Southeast Asia, Sub-Saharan Africa, whereas developed country has a low rate of HPV career rate. For example, HPV-SAG prevalence is less than 2% in United States, Northern Europe, Australia, and parts of South Africa. As a WHO reports, the introduction of mass immunization campaigns, the prevalence of HPV notably changed, resulting in a decrease of the HPV-SAG career rate and HCC incidence. The rate of HPV infection decreases. The tendency of HPV is shown in the graph. However, though the entire tendency is decreasing, we still need to notice how the difference of medical system causes different situations. Immunization coverage rate in Africa is low. In Middle Africa, immunization rate is lower than 50%, whereas other parts of the world is increasing from 0% to 90%.
When it comes to distribution of responsibility, there is a strong variation in how certain countries divide healthcare. Countries such as Australia, Canada, Switzerland, Denmark, England, Italy, Norway, New Zealand, and the United States are found to split the responsibility between different parties. According to the International Healthcare System profiles, many of these countries place the government or a separation of levels within government in charge of providing healthcare. In contrast, countries such as China, Germany, France, India, Israel, Japan, Netherlands, Singapore, Sweden, and Taiwan all show a sole responsibility of healthcare in place. All of these countries listed, with the exception of Germany, list their government as the party carrying sole responsibility. Germany's healthcare shows virtually no involvement from government, but is instead maintained by self-governing associations.
And how do you see the effects of global stratification on global healthcare?
Well, I do think global healthcare is going to be a pressing issue moving forward. And part of the reason why is because healthcare systems are expensive and require a lot of resources in which to do.
So how do you see the effects of global stratification on global healthcare?
What?
Well, I think you see it because you see it in in poorer, less developed countries. They have a worse healthcare system, and that's the global stratification right there. Their hierarchy, them on the hierarchy, on the healthcare hierarchy, are lower because they're less developed, because they have less resources, because they have less money.
So we have a global population that's increasing in size, and it's going to continue to exponentially increase in size because people are going to be living longer in developing nations such as India and in China. We see their longevity increasing.
I guess I don't because
It's a great question. You know what? Define your what context you think stratification.
What do you mean? And I believe it's just mostly to do with money and resources the community has and the nations has, and that we should do better to make it more fair for every citizen and human to have at least enough healthcare to live.
I don't know. I have no idea how to answer that one.
Whereas, America and other very developed and richer countries obviously are higher on the hierarchy, and because they're richer and more developed, and because of that, the people end up, more well off, healthcare-wise, and with better healthcare providers and whatnot.
I guess there really is an effect because what I'm trying to say.
Yeah.
Okay.
I think I know what you're trying to do. We'll scrap that question.
So I do think there's going to be an incredible burden placed on the entire system just because of healthcare allows people to live longer. They consume more health resources, especially towards the end of life, that it's going to be a real resource challenge, I think, in 40, 50 years from now, when everyone, the global life expectancy moves from roughly around 60 years to more like 80 years, you're going to talk about more of a population explosion. So I think it's going to be a challenge in which to manage those types of healthcare systems.
The global forces that affect international healthcare are largely a result of global stratification. The developed world has increased access to healthcare compared to that of the developing world. Such forces include poverty, lack of infrastructure, and globalization. Countries with less money are less equipped to have adequate healthcare for their populations. There is a significant correlation between the countries with the highest rates of hepatitis B and the countries with the highest rates of poverty. All of the countries with a prevalence of hepatitis B of 10% or greater are found in sub-Saharan Africa, according to the World Health Organization. Sub-Saharan African countries also make up the largest percentage of the United Nations Multidimensional Poverty Index, at approximately 42%. Infrastructure is the cornerstone of any nation's healthcare system. The lack of infrastructure in developing nations is a large part of why healthcare is inaccessible in the developing world. A lack of hospitals, roads, and consistent power prevent people in developing nations from being vaccinated, tested, or treated for hepatitis B. Even in urban areas where there is better infrastructure than rural areas, slums, where the poorest of the urban populations live, do not have sufficient roads for ambulances and emergency services to access.
Around the globe, members of certain religions and cultural groups reject the use of modern medical devices such as medication, vaccinations, and other preventative measures to ensure the health of their members. In Minnesota, the large Somali population has been told not to give their children the MMR vaccine, which is a vaccine to combat measles, mumps, and rubella. This has caused the number of measles, mumps, and rubella cases to skyrocket within the Somali community. The reason for this is the campaigning that pro-anti-vax campaigners petitioned in the Somali communities in Minnesota.
A study was done on AIDS orphan children in Uganda. These children were orphaned by the death of one or both parents due to AIDS. The study detailed two groups, the treatment and control groups. Students from 15 different schools either received child savings accounts, workshops, and mentorships, or they didn't, while both groups were still receiving traditional support services like counseling and school supplies. The groups were compared after 10 months of being in the study, as well as a baseline at the beginning of the study for comparison between the two. The treatment group reported having significantly reduced sexually risk-taking intentions compared to those in the control group. It's very possible that this result could be found if the study was done in poverty-stricken areas in the United States. Having economic assets has shown to have an influence and reduce sexual risk-taking intentions among adolescents in a country like Uganda, and it is quite possible that this holds true anywhere.
The worldwide demographics of socioeconomics has had a big impact on healthcare for people. In 2002, it was stated in a study by Health Affairs that 40% of people who did not graduate high school were not insured with healthcare. Of this 40%, 60% of those were low-income families, and this problem has only continued to persist over time. Oftentimes, these low-income families have had more difficulty obtaining quality healthcare from the start because of the disadvantages they face, especially in comparison to higher-income families. For example, recreational activities, good nutrition with food from the grocery store, and schooling for a higher education can all help benefit people to lead healthier lifestyles. As research has demonstrated, there was a strong association between higher rates of mortality and disease amongst lower-income families the more these families' incomes decreased. In order to spread more awareness about how to better global healthcare, it's important to take into consideration how access to it is determined by the social and economic factors that stand behind it.
The World Health Organization estimates that environmental hazards are responsible for nearly 25% of all deaths and 36% of deaths in children. The environmental effect on health is a pressing issue that tends to be overlooked. A person's environment greatly affects their health and well-being. Those living in extremely overpopulated and impoverished areas are at much higher risk for the disease, such as hepatitis B, due to the contaminated water supply and poor sanitation. The most vulnerable people cannot get their basic survival needs when the environmental factors such as hurricanes, droughts, and floods are affecting their location constantly.
In global healthcare and medicine, education serves as a necessary tool to prepare individuals on how to protect and prevent the spread of different diseases or illnesses. Thus, the need for a good education is extremely important for the welfare of any society. However, this is where the problem begins to become apparent. According to an article by the WHO, the World Health Organization, a third of all new HIV infections around the world are estimated to occur among youths aged 15 to 25, and teen pregnancy rates are on the rise in many places. Another aspect of education deficiencies playing a role in contributing to the gap in healthcare and medicine is literacy rates, along with other foundations of preventative sex education. Studies show that countries with lower literacy rates also tend to be more inclined to have more sexually transmitted diseases and infections. Also, this highlights another reason in which less economically developed countries may be more susceptible to common diseases: the role of government. In the article, WHO mentions the roles of government to offer sex education to young people to promote teenage reproductive health, yet inconsistency exists in the related initiatives in the global context. Essentially, this addresses the need for more health education, provided by the government, needed in schools to further educate a country's citizens in a time in which they need guidance and knowledge. Ultimately, education plays a major role in teaching and preventing the spread of numerous diseases. Therefore, in terms of global healthcare and medicine, the gap between differing economically developed countries becomes apparent when we dive into the strength of their education systems and access to resources in order to fund these programs.
Despite how far medicine has come in recent years, global healthcare is still lagging behind, with many people around the world having little to no access to treatment and medicine.
This pressing issue will only become more prevalent in coming years due to the lack of effort made in order to solve this problem internationally.
Go to the World Health Organization to learn more about how we can help with this prominent issue.